Hello, I'm Dr. Gueye with the Visionary Women's Health Clinic, and today I'm going to talk to you a little bit about your very first pelvic or GYN exam. And my hope is that by the time you finish this video, you are going to have all your questions answered and you're going to feel more comfortable and prepared to see your gynecologist. The first question to answer is, when should you see your gynecologist? Now, if you are sexually active or the age of 21, you need to start seeing your gynecologist. I recommend all my patients have a GYN that they feel comfortable with, can talk to openly, that feels like listens to them and listens to their concerns. See them once a year, and then also have a primary care doctor or a pediatrician, depending on your age, that you also see regularly. Together, and that partnership is going to make sure that you stay healthy and you get all of your concerns and your needs addressed. Now, let's get right into the purpose of the Well Woman visit or the GYN exam. Your gynecologist is going to essentially make sure that your anatomy is normal, address any concerns you have from a GYN perspective. They could be things like vaginal itching, odor, discomfort, abnormal bleeding, or other hormonal issues. Sometimes women have migraines that are related to their hormones, acne that's hormonal. So definitely bring up all your concerns with your gynecologist, and we can determine whether or not there's some overlap with your GYN systems and health, and see what he or she can do for you. Let's go into what is actually going to happen at your GYN exam. In addition to making sure your anatomy is normal, your gynecologist is going to make sure that you are on top of any sort of cancer screening that needs to happen, and also do a lot of counseling. A lot of preventative care is going to be given, and also symptomatic care for any problems. Now, every visit of mine, at least, and for most gynecologists, you're going to get a pelvic exam, a breast exam. Your thyroid will be checked. At least we definitely do that at the Visionary Women's Clinic, because the thyroid is very, very important with women's health and your GYN health. And then I also do a back exam, check your extremities. Depending on your health history, we may also do a lung exam and a heart exam. Now, when you walk into the GYN room, you're going to see an exam table that looks very much like this one. Nothing really to be afraid of. These legs are going to come out just like so, and you're going to put your heels in these stirrups, and then you're going to come to the edge of the bed. So your bum is going to sit right there. And what that does is it's going to help bring your cervix in view for your gynecologist to properly see. Now, unless there is pathology, and if your exam is done properly, it really shouldn't hurt. What you're going to feel is a lot of pressure, especially if it's the very first exam. This is a feeling you're not really used to, and so it can be a little scary when you're feeling something new. But rest assured that if the exam is done properly, what you're going to feel is a lot of pressure, like something is sitting on top of your vagina. But you shouldn't feel pinching or any pain. If you do, definitely let your gynecologist know. During the pelvic exam, your gynecologist is going to use a device that looks something like this. Now, you can see this is not a very wide device compared to my finger, and I have very small fingers. It's not very wide, and only the tip of this device is going to go into the vagina and then get gently open so that we can visualize your cervix at the tip of this device. They come in metal form, plastic form, and they will get coated copiously with some gel or some water to make it comfortable. And this is how your gynecologist is going to be able to view the internal anatomy in the vagina, take a look at your cervix, and then they're going to also insert 2 fingers in the vagina to feel the outside of your uterus as well as your ovaries. So a lot of information can be gleaned from this exam. And again, it's really nothing to be afraid of. After that exam is done, typically the remainder of the exams that I mentioned will also occur. Again, I highly stress the importance of finding doctors that you'll feel comfortable with and that you feel like you can have an open conversation with. Studies have shown that when you have a good doctor-patient relationship, you have better outcomes. I hope that this video has helped you feel better and that you are going to be prepared for your first pelvic exam. If you have any questions, leave it in the comments.